Hi everyone. This video is going to briefly talk about my experience with SSRIs, but mostly I'm going to talk about the withdrawal process and try to give you some hope, some guidance, and some other tips and advice I learned by going through withdrawal. So from the outset, I just want to say that withdrawal is extremely difficult, but it does end and you definitely do recover. So if you are watching this video and you are going through a bad withdrawal right now, just know that there is there is hope. You will definitely get better. You are not going to be, the exception or the one person that somehow doesn't get better. You're definitely going to get better. I'm now 6 months out from last having taken any SSRI, and I feel pretty much back to normal. And I'm going to get into all the details in a minute, but I really feel pretty much okay now. So you're definitely going to get better. So as far as background and why I went on SSRI, I'll just do this very quickly. I have some very severely herniated discs in my neck. Occasionally the pain will really flare up. And last summer, the summer of 2017, I had a very bad flare up, extremely intense pain, started to become very depressed, very anxious about the whole situation. Um, and had some panic attacks and things like that, especially because I had some concerns that I may need to get cervical disc fusion surgery at some point. And so I eventually went to see a psychiatric nurse practitioner who prescribed me Lexapro, 10 milligrams, and I felt pretty good when I was on the medication. Really, I didn't have too many symptoms. Had a couple of symptoms, but really pretty much fine. The medication definitely works. I had a pretty positive outlook on things when I was on the medication, and didn't have really that many complaints about it. But still, even so, at 6 months, I decided, you know what, it's I don't want to be on this forever. There are a variety of risks from staying on a medication forever. Um, and I figured, okay, you know what? It's time for me to try to get off. So I discussed it with my nurse practitioner, and she said to cut down the dose to 5 milligrams for a couple of weeks, and then after that, I could just stop. I could just discontinue the medication. So that's exactly what I did. I cut my dose in half to 5 milligrams, and after about 2 or 3 weeks, I stopped completely. Now, cutting down in half, I felt no symptoms of withdrawal really whatsoever. Um, and then about a day or two after I completely stopped, that's when all the withdrawal symptoms really kicked in. So the first thing I noticed, I got up in the morning. This was 1 or 2 days after I had completely stopped taking Lexapro. I had what everyone calls brain zaps, and at the time, of course, I didn't know that they were called brain zaps. I actually didn't even know what was going on at all. I just felt a weird hiccup-like sensation in my head. That's really the best way I can describe it. It feels like a hiccup is going off in your head, and it's a bit of a jolt-like sensation. And there's also a little bit of a internal sound kind of going off every time one of these jolts occurs. So almost like a lightsaber battle is going off in your head, kind of like an electrical noise going off at the same time. And this was unrelenting. It would go off every, I don't know, maybe every second almost, really, um, for the first few weeks. I think every couple of seconds. I could make this symptom come on by moving my eyes to the side, and I know that sounds very unusual, but I actually, from what I read, this is actually kind of common. People just moving your eyes for some reason causes a brain zap to occur, but it would still occur even without doing that. And when you're having these brain zaps, you feel like you're losing your mind. You just feel like you're going completely insane. It's really one of the worst symptoms out of all of them. Other symptoms I had were just an overall very angry, bitter, frustrated disposition. I just had a sort of an anger with my nurse practitioner for not really understanding this. I had a general anger with kind of the medical system as a whole for not really alerting me to these dangers. Um, my emotions were just kind of all over the place at least for the first few days for sure. And then I also had extreme fatigue. Um, Fatigue doesn't sound like a really bad symptom. It just sounds like one of those general things that people get when they don't feel well. But this was a fatigue that I had never had before. I've been sick with a cold or a flu or different things like that. I've been tired or cranky, but this was particularly bad. So I was going to bed at 7:30 in the evening and still having trouble getting up the next morning. Weekends, I was sleeping 14, 15 or more hours a day. It felt like just extremely exhausted for about a month almost. Then I also had tinnitus, ringing in my ear. This I felt like this started about 2 or so weeks after the withdrawal began. I started noticing a very high-pitched, piercing sound, sometimes almost like a tea kettle was going off. Um, it would typically only bother me in a quiet environment, such especially in a dark, quiet room, like right before I would go to sleep. It would really be loud, and that was really really annoying. And it would even bother me sometimes at work in a quiet office setting. It could really be distracting. I also had some jaw pain and tension along my temples, and then I also had like flashing lights, and especially in a dark room, I would move my eyes to the sides, and I would get a flash of light. And then I also started noticing floaters, which are basically you can look it up, of course, but basically they're like little hair-like strands that appear to float around your field of vision, and it was all pretty annoying and pretty uncomfortable. And this was all just after 6 months on a low dose. So I was pretty frightened by the whole experience. So really, I was freaked out. I was really upset. I didn't know what was going on. My nurse practitioner didn't say anything, didn't really seem to care. Same thing with my primary care physician. He really offered me no advice, essentially just told me to deal with it. In many ways, I really didn't get the sense that they even believed me. So, of course, I turned to a variety of online resources to try to find other people with similar experiences. And of course, YouTube was among those. And I did find some good videos on here about people having successfully finishing a withdrawal experience. So that of course gave me some hope. But even so, it was a tough experience. So because I wasn't getting answers from my primary care and from my psych nurse practitioner, I felt like I had to go see some specialists. I went to an ophthalmologist to check out my eye issues, and I was told they didn't really see anything, and that Lexapro shouldn't really cause any of that. I went to a TMJ expert who made a mouth guard, and he was the only one that really said that SSRIs could cause people to grind their teeth. So that may have been why I had some of the jaw pain. I may have been grinding my teeth in my sleep. So he made me a mouth guard, and I wore that. Um, I went to an ear, nose, and throat doctor, or an ENT, for an auditory exam, and he actually then got me a brain MRI because I was so distraught about the whole thing. And I then went to a neurologist to go over the results of my MRI, and for the most part, it was pretty normal. There were a couple things, but you know, the neurologist and the ENT really gave me no real idea of exactly what was going on, what the brain zaps were about, what any of these symptoms were really all about. And then the other thing I did was I went to see a mental health therapist, and that was pretty good. I felt like going to a therapist just to talk about things was pretty helpful, and I'll get into that a little bit more in a minute when I talk about advice and tips. Of course, during all this time, I still had to go to work. I still had family obligations. I have a 2-year-old at home. But in general, I didn't really see anybody for a couple of months. So I sort of kept to myself and just did what I had to do. And during the first couple of weeks, I did take a few days off of work here and there when I absolutely had to. I pretty much just, did what I had to do to get through it. So where am I now? Well, it's been a little over 6 months, and I feel good overall. The symptoms of withdrawal are basically gone. Um, Tinnitus seems to be the one that is the only symptom that's kind of persisting, but to a much lesser degree. It's not nearly as bad as it was during the first month or two. It's much quieter. It really only gets bad when I'm in a very quiet setting, such as when I'm going to sleep. And for that, I just use some white noise, and it's been pretty much fine. So as far as advice, um, I would definitely recommend going to a mental health therapist if you're having a very difficult time with withdrawal. It can be very useful. The type of therapy that I did is, or am still doing, is called cognitive behavioral therapy. Um, Many of the people, though, I think the therapists that you might find still don't even really know about withdrawal from these medications. But I imagine some of them do. So obviously, if you can find a therapist that knows about withdrawal and can talk to you about things like that is definitely better. I would also say exercise. It's very hard during the first month or so with the brain zaps and the dizziness and everything like that. But I would try to do a little something anyways and see how it goes, and then slowly ramp it up as you get better. So for me, I didn't do any exercise for the first maybe week or so, but as I slowly started to get better, I did go to the gym and would go on the stationary bikes. Just things that I knew that if I got dizzy, I wouldn't just sort of fall over. Maybe like a treadmill or swimming or things like that may have not been wouldn't really be the best to do when you're feeling dizzy or have brain zaps and things like that. But certainly a stationary bike or something safe like that would probably be appropriate. Uh, I would also say just overall eating well. Making sure you eat your fruits and vegetables and things like that. Just make an overall commitment to your health. Drink lots of water and things like that. Now, obviously, just eating well, that's not going to make you better by itself. Um, the way I look at it, though, is that no one is going to tell you that eating well is bad. So certainly, it's not going to hurt you. And I think what you're trying to do during a withdrawal process is let your brain do the work. Your brain is the thing that's going to have to sort of get better on its own. You're going to have to let your brain do its work, but in order to let your brain do its work in the best way that it can, you need to give it the right nutrients. You need to let it repair itself. So eating well, at least just from my own perspective, I think is certainly gonna help at least somewhat. Uh, Alcohol, other medications, and things like that. I really try to avoid anything alcohol, caffeine. I completely cut that out of my system. I occasionally took ibuprofen for neck pain and things like that I have. I also took a fish oil 1,000 milligram supplement, which some people swear by. I can't really make any claim as to whether or not it helps, but I certainly don't think there's any harm in taking a fish oil supplement, which some people say really helps with brain zaps, although I really don't know for sure. Um, if you have family or significant other in your house, you've got to let them know what's going on. They're not going to really get it exactly, but you've got to talk to them. They've got to be understanding of what's happening. Um, it's so hard, I think, for a person from the outside to look at a person going through withdrawal because you don't really look that bad, but inside your head you've got all these emotions running wild, and you just got to sort of tell them what's happening and hope that they can help you through it. And clear your schedule. This isn't really the best time to be social. So don't really be trying to make plans with friends and things like that. Um, and if you can, also, if you're not currently in withdrawal, in other words, if you're thinking about going through withdrawal, or if you're thinking about stopping your medication, try to plan it for a time when you know you're not going to have any big social engagement for at least a couple of months, or any big work event, or anything where you might say have to make a presentation to your coworkers or something like that, because you're not going to want to do those things when you're going through withdrawal. And then lastly, try to tell yourself, as much as you can that you're going to get better, because you really will. It really does get better. It's just a very slow process. I wish I could give you an exact timetable. For me, the bad withdrawal was really about 2 or so months. And by the third month, I would say I almost felt like I was about 90 some percent better by then. And so every week or so, it would just kind of feel like it slowly got better and better, and the symptoms would slowly fade away. Um, and that's just and that's really the only timetable I can give you. That it just slowly gets better. And the reason I can't give you a better timetable is because it seems like everybody's different. I've heard some people say that they have virtually no withdrawal. I've heard some people say it lasts about a week or so. And I've heard some people say a month. I've heard some people say, 2 or 3 months, like I was. And then I've even heard some people say even a year or so. But if you're even one of those people that it lasts for a year, don't 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 be too afraid, because it's not like these people just were having a horrible time and then they flipped a switch and then they suddenly got better. I'm almost positive that all the people, even the people where withdrawal lasted for a year or more, that it was slowly fading out over the course of the year. So it wasn't really that bad all through the year. It just took a long time to get better. So that pretty much covers my thoughts. Please feel free to comment, and if you have any questions, I'll try to respond. And thanks again. And if you're going through withdrawal, I just want to leave you with the thought again that it's not forever. It really does get better. You're definitely going to get through it. And good luck.